Hello, my name is Cole Hardman, and welcome to an inside look at hospital medicine, caring for our most medically complex kids. My name is Cole Hardman. I'm a major gift officer for Seattle Children's Foundation. Thank you for being here today. It is because of donors like you that Seattle Children can advance its mission of providing hope, care, and cure to help every child have the healthiest and most fulfilling life possible. I would like to also take a moment to thank our Guardian Circle members who are in attendance today. These generous donors have included Seattle Children in their state plan, which creates a pipeline of support for future generations. I am proud to call myself a member of the Guardian Circle. Today's topic is especially meaningful to me. Not only am I proud to be an employee at Seattle Children, but I'm a very grateful former patient myself. I was born with multiple birth defects, and I'm lucky that Seattle Children saved my life at birth and enabled me to live a fulfilling life. My treatment required doctors from multiple specialty areas, so I know firsthand how important it is to have a team at Seattle Children's dedicated to medically complex kids. This is a picture of me with Margot Myers from Como News supporting a telethon back in the day during the time when I was a patient ambassador. Now sit back, relax, and enjoy the show. Please enjoy this 3-minute video about Whitney and her son Malachi. We will then be joined by his care team.
I wanted to be awake for the C-section. I was really concerned that if they put me under and I went to sleep, that I wouldn't ever get to see him, that he wouldn't make it. Right after his second trimester ultrasound, Malachi was diagnosed with spina bifida. It felt like every time we went in for a test, it was just one more diagnosis. On day 1, he went in and had a spinal surgery to close up the open part of his spine, the spina bifida. And on the second day of his life, he went in for brain surgery to have a shunt installed to correct the buildup of pressure, which can be fatal. He was almost 8 months old when we finally went home.
After having 2 seizures, a third medical transport, and it just being to the point where it's like, we've got to be close to Children's Hospital.
Throughout Malachi's life, we have built the absolute best village. It's the coordination of care that really sets things apart for us. The medical teams are top-notch. It's everything else built up around the medical care that really makes us feel safe and at home when we're there. And that is the stuff that the donors provide. When people give and support these programs and services, they're really bringing back light. They're bringing back that hope. I would hope that people choose to give to Seattle Children's because all the families in the hospital, they only want one gift. They just want their kid to live. And I think it's that gift of a future. That's why people should give.
And now I'd like to welcome our medically complex care team to share about their work.
All right. Well, thank you very much, Cole. I'm Brett Leggett. I'm Medical Director of our General Medicine and Medically Complex Services. And it is an honor to be with you all today to celebrate both Malachi, his family, and all of our kids with medical complexity and special healthcare needs. Next slide, please. There's so many things that make our patient population, our population of kids special. And one of those things is really their diversity of background, the diversity of illness. And within that box that you see there on the left is really represented literally thousands of different very rare disease processes that our kids can experience. Generally, when a child has a chronic disease, the doctors and the other healthcare team members can usually, based on lab tests and other patient characteristics, be able to make an educated guess about what that child might have in store for them in the years to come. And with a lot of our kids with medical complexity, that's not always possible with how many potential illnesses could be at play. Even a second child who may have the exact same illness as another may have a very different life experience than someone else with the exact same very rare disease. One of the things that oftentimes our kids do have in common, however, are the things that you see in the box on the right, where a lot of our kids are very dependent on different technologies. And those technologies, like with anything, can be prone to complications and challenges as kids get older throughout the years. Next slide, please. So this is really just a visual representation of some of the many things that our patients and families have to contend with. For those of you who have a child in the family, whether it be a son or daughter or a grandchild or someone else that you know who maybe has chronic illness, there's really a wide spectrum of disease that can occur and different challenges. And some of you may know that even just having one or two or three specialists can be a challenge. Just imagine having a dozen or 15 or more medical specialists. And on top of that, different therapists and care coordinators and social workers, not to mention all of the other things that you see represented up there, ranging from school services to different financial and payer resources. And this is a huge burden that we as a healthcare system unfortunately impose upon our patients and families. And it's impossible for them to do it alone. So care teams like our medically complex team and our care team at Seattle Children's in large do our best to help address some of these gaps that can help as our families try to contend with navigating the healthcare system. Next slide, please. So our medically complex team, or our MCC team as we call it, currently comprised of 14 physicians, 3 nurse practitioners, and case managers who help coordinate care. And our case managers will help coordinate everything from follow-up appointments to what we call durable medical equipment, which is really all of the life-sustaining care that our patients need in terms of oxygen or other equipment that's needed in the home environment. And as you see there, our mission and vision as an MCC team is really to try to offer a comprehensive and coordinated approach to the care of our kids, with really an emphasis on quality of life. And as a physician, it's not for me to define what quality is. That's a very personal decision that all of our patients and families have to make. And we do our best to facilitate those conversations as goals of care may evolve over time. The other point that I'd just like to briefly mention is continuity. You know, in the same way that your pediatrician in the clinic outside the hospital is on point to try to help coordinate care, bring all the specialists and other care team members to try to do the right thing for the entire patient, not just a collection of medical problems. We try to do the same here as an MCC team, where we really try to represent the family's story so that every time a child like Malachi comes back to the hospital, we can be on point to represent what the story has been, so that the current doctors, whoever may be involved, even if they weren't present last time during the last hospitalization, it doesn't force the family to have to start over and tell their story all over again. So we try to represent that story the best that we can. And now a few words from my colleague, Dr. Bishop.
Thanks, Brett. I'm Dr. Julianne Bishop, and I'm a hospitalist at Seattle Children's and a member of the medically complex care team. And I thought I'd speak today a little bit about why I chose to be part of the MCC team and be an MCC provider. So I've now been at Children's for almost 20 years, and back when I was a resident, we didn't have a lot of training on how to care for these medically complex children. And frankly, there were fewer of them in the community and in the hospital than we see today. And so as I entered my career as an attending physician, I really desired to enhance my own knowledge and improve medical education on conditions common to MCC patients. What I would find is that these patients often came in with a whole list of complications. They might have medical technologies that I wasn't familiar with. They might have multiple medications. And of course, their families were their greatest and advocate and strongest defender. And so as a young practitioner, I often found myself a little bit intimidated by these families. And so one of the goals that I have now as an MCC provider is to be comfortable in caring for these children and helping to teach new physicians how to be comfortable working with these families. Another reason that I'm so passionate about the MCC program is that along with pediatric medicine, I've always found myself interested in palliative care and ethics. And working with this team really has allowed me to use these interests in my day-to-day relationships with families. When I entered pediatrics as a career, I actually envisioned myself being a primary care physician and having these lifelong relationships with children where I might meet them shortly after birth and follow them until they graduated from high school or college. As a hospitalist, we aren't necessarily given that privilege, as we often see children when they come in for one acute illness and then we send them off home once they're better. With our MCC team, our children often end up coming back to the hospital, maybe multiple times in a year, multiple times during their lifetime. And being part of this team has really allowed me to make lifelong relationships with these families from birth to adolescence, and for some of our patients, even through the death process. And then finally, I think one of the greatest opportunities of being part of the MCC team is being able to collaborate with colleagues across all the different medical specialties, ancillary staff such as our care coordinators and our team coordinators, physical, occupational, and speech therapists, and of course our families. And working together to really serve as a quarterback or a coach of all of these people to provide holistic and happy quality of life care for all of our patients. And now I'll pass it on to Annie McDermott, who will talk a little bit about why she chose to become an MCC provider.
Hi, my name is Annie McDermott, and as Dr. Bishop just shared, I'm a nurse practitioner on the Medically Complex Child Service. And I found myself in this line of work as I started as a pediatric intensive care unit nurse. And I always remember my favorite moment being the time after rounds when I could spend some good time with family, discussing and kind of translating what the medical plan for the day or their entire stay might be. And I realized that that could be translated into a job as a nurse practitioner. And I had actually met some practitioners at other facilities that had worked in a similar role, helping coordinate care for complex children. And so I truly feel as though I've kind of fallen into my dream role as a nurse practitioner as well, and continuing to help families make big decisions for their child and to help make sure that they have all the information that they need to make the best decision for their goals and for their family moving forward. I'll take a quick moment to talk a little bit about myelomeningocele, as this is the disease process that Malachi had. And as Whitney mentioned in the video, it's also known as spina bifida. And myelomeningocele is the most common of what we call open neural tube defects. So what an open neural tube defect is kind of an opening or a cleft in the area that that covers the spinal cord that results in that area being exposed. And then usually our children that have this disease process will have maybe trunk, lower extremity, bowel and bladder dysfunction moving forward in their life. As you can see, it occurs in a few out of every 10,000 births in the United States. And I think what's interesting about this disease process is there have been two kind of key advances recently. We know that folate deficiency can be a big risk factor for myelomeningocele, and our ability through sonography and prenatal laboratory work to do screening has really reduced the incidence of myelomeningocele. There are also genetic factors that we don't necessarily know as much as we'd like to yet that definitely play into the incidence and prevalence of myelomeningocele, but those are kind of some interesting facts just about it. Next slide, please. This is an interesting patient education tool that I helped create with our team recently that really is used to help guide a family through the experience of having a newborn with myelomeningocele. So what we do is this acts as somewhat of a checklist or a pathway home for families, just to orient you a little bit to what this might look like. The first column on the left would go over all the things that a family might need to do and the child might need to complete before being able to leave the NICU after they have their initial spinal surgery and repair. Next, we kind of talk through all the imaging that they might need, and then all the different skills that the family would have to learn before being able to take a child home with newborn myelomeningocele. We learned from families like Whitney and Jason and Malachi that the process of being diagnosed with myelomeningocele and then all the skills needed to take a patient home safely were quite overwhelming for families and took a lot of time and energy. And so this is just an example of something that our team helped formulate and helps guide primary medical teams through in the transition from birth to safe discharge. So with that, I think I'm going to hand it back over to Cole.
Wonderful, thank you. Thanks so much for all of you for your work and knowledge and sharing it all with us. We are delighted to have a current patient family ambassador with us, Whitney Stohr. She will introduce herself as Malachi's mom, but she is also a very involved member of our community. Whitney has a law degree from Gonzaga and an advanced degree from the George Washington University Law School. She volunteers her time to advocate for accessible and affordable play through Fair Play Library, and she is a tireless advocate for disability rights. Earlier this month, she participated in a press roundtable with Senator Patty Murray and other disability rights activists to advocate for better support for individuals with disabilities and for their families and caregivers who care for them. Whitney, welcome.
Hello, everyone. Thank you, Cole, for that introduction. I'm really happy to be here today and have the opportunity to meet you all out there in computer land, even if it's still just a virtual wave. Hello. My name is Whitney Stohr, and I am Malachi's mom. That is by far my most important job and my favorite job. Though, as Cole mentioned, I do wear a few other hats. I'm a community advocate and coalition builder in our area, and I'm part of the Family Advisors program at the hospital. And little Mr. Malachi is quite the dedicated patient ambassador as well. I am honored to have been invited here today to share more about our experience at Seattle Children's and to brag up the amazing work of the MCC service. The members of that team who are here today and all the members of that team are the real MVPs. They are phenomenal at what they do. Now you saw Malachi's video just a little bit ago. It showed the beginning part of his journey, his brain surgery, his heart surgery, his tracheostomy, and with that, his ventilator. The hospital did a beautiful job on that video. It just about brings tears every time I see it. But the thing with that video is that as amazing and as inspirational and as uplifting as it is also just a highlight reel of the time we've spent at the hospital. It shows our outcomes, but not the long process of actually getting there. And you all are not here for the highlights, you're here for the inside look. So put your questions in the chat box. Start thinking about them now because we are gonna have a Q&A session after this. But again, that video marks some of the monumental days in our lives, in my family story, in Malachi's story,
But that highlight reel, no matter how beautifully done, cannot capture the full breadth of any one story, nor the extent of one's team's impact on the life of the child. What a video cannot show is the day in and day out effort of this team. It can't convey their genuine concern or the way they employ their time and their talent and their experience to change the life trajectories of kids like Malachi. It doesn't show how hard they work to identify problems and to find treatments that work and to get families back home where they belong. This team works across disciplines. They invite everyone to the table to help find the right solution. They do everything they can to send families like us home feeling safe and comfortable caring for our very complex kids. And they make us as parents feel like we're actually part of the team. So the value here is that the MCC service it's a hub in this wheel of care that builds up around medically complex kids. They are the team that stands at the center and manages all of these medical decisions, these medications, specialists, therapists, and every other program and service involved in complex care. And when you're talking about a child who sees a dozen specialists, multiple therapists, equipment providers, dietitians, geneticists, and more, and that's just at the hospital. Outside of the hospital, kids like Malachi require multiple pharmacies, medication management, medical supplies, special education and enrichment programs, and piles and piles and piles of paperwork. When you start considering all that is involved in caring for medically complex children, only then do you truly appreciate the role that MCC plays in the lives of these kids, and that's just the logistical role. They also play a deeply important emotional role for our families. For families like ours, MCC has been there for us on our very best days, when all is right in the world, and after nearly 8 months in the hospital, you're finally going home for the first time. And they're there on the really hard days when you're on your knees in the corner of a room watching your child struggle to breathe, and you know things are not going well, and there are so many tears, and you just cannot take it 1 second longer. They are there on those days too, because they have been there every day, every step of the way, and you know that they will be there for you tomorrow when you show up in a room at 3 a.m. exhausted and worried about some new medical issue with your very complex child, because that is what MCC is for our kids. They know our kids, and they are that constant presence in our lives. And the value of that in terms of care and the long-term health of the family as a whole unit cannot be overstated. I can sit here for the rest of today and regale you all with stories of all these amazing details about this team and the value and the benefit of the MCC service, because despite my obvious bias, I nevertheless believe that this team is one of the true gems of this hospital. This team is what brought my family to Seattle. These people are why we packed up our lives and moved across the state to live here. They're spectacular. And as much as I could go on gushing about everyone involved with MCC, I really do want to get into that Q&A. So in closing, I want to thank you all for being here today, truly, because I know each and every one of you here supports this hospital as donors. The foundation even has a specific fund, a way to line item donations to direct your support to MCC programs, to fund MCC research and services that in turn support our families. And that's pretty amazing, right? So whether you donate specifically to the MCC program or to the Uncompensated Care Fund, or through the Guardian Circle or the Research Champions or the Circle of Care program or any other funding programs, however it is that you support this institution, I want to thank you. You make a difference in the lives of our kids and our families, and your impact is so truly valued. So thank you. And now we're going to switch back gears a little bit. We're going to bring back the MCC team, and we're going to do some Q&A. So let's see. So our first question is, we have talked today about our family's experience with MCC care here at Seattle Children's. You've seen our video, but to the MCC team, can you talk more broadly about the impact of your team and the impact it has on the lives of some of the other medically complex kiddos and their families?
Thanks, Whitney. I think I can answer that. And I just have to say thank you for your kind words about our team. It really made my heart swell while I was sitting here and listening. And I think the first thing I'd say is that, like, it's such a joy every day to get to come in and work with families like Malachi and Whitney. And we have the true blessing and opportunity to spend those really, really good days with families, but also to get to see them when they're not at their best. And that is what makes me want to come to work every single day as an MCC provider. I think to go along with some of the things Whitney said, some of the experiences that I have seen through my years as an MCC provider is, I have one family that I will always carry with me in their heart. I remember meeting mom and dad and their baby daughter on her second day of life. They had been transferred from an outside hospital where the baby had started having seizures, and both parents were terrified because this was not what they had expected for their birth plan. We spent our first few days together learning more about this child's seizures, and soon I had to tell the family the bad news that I didn't think this was a one-time occurrence and that this was going to be something that they would be managing for the rest of this child's life. At that point in time, we didn't identify that child as an MCC patient. I'm not even sure if we had an MCC team yet, but as time would go on, we would see this patient again and again and again, and she would become another one that was the heart of our service. She would come back with multiple seizures. She would come back with difficulties with feeding. And we would celebrate after months in the hospital when once again her valve began to work and she was able to go home. She came back one last time after a cardiac arrest at home, and our team was able to spend that time with her and her family as they made decisions. Some of the amazing members on our team were able to work with our palliative care service and arrange to have her take her last moments of life out on our beautiful rooftop garden with the flowers blooming and the sun shining, just the way her parents had dreamed. And as I was standing there with many of my colleagues, I was pulled by the father to the bedside to say final goodbyes. That is what being an MCC provider is all about. Being there with the families to celebrate their joys and to walk in their sorrows and to do everything we can to make their children's lives the best that they can be.
That's a really good story. Next question is, if you can talk just briefly a little bit about what you are most proud of, maybe with regard to some of your MCC work or that of other members of your team.
I can take that one with me. Yeah, there's so many things I think we could point to, and yet something that comes to mind, some major project work that we did this past year, and I certainly can't take credit for this. This was led by one of our other nurse practitioners who's not able to be here, Amber Bach, amongst other team members, was our end of life pathway. As Julianne alluded to a little bit earlier, unfortunately, there are some kids who, their journey comes to end, earlier than any of us would hope. And when that happens, there's always a risk that other care gaps might develop at a particularly vulnerable time for the child and the family. And, when you think about everything from, child being in the hospital and needing certain medications to feel comfortable before they pass, to think about all of the supports that are needed as far as social work and different nursing supports, and even things like making sure that the caregivers are being attended to, and do they even have enough to eat and drink, let alone sleep at that moment. There are just so many things when you break down that process, not to mention supporting the family in the bereavement process after the child passes. And like so many hospitals, we did not necessarily always do the best job that we could in supporting families through that process, and just had a lot of systems variation. And so what we committed to a couple of years ago was to standardize that process to eliminate the unnecessary variation that there is, during that particularly vulnerable time for our families. It's not to say that, every child and family's experience is unique, and their needs are obviously very unique at that time. But at the same time, you shouldn't have to reinvent the wheel to support families. And we came up with a whole set of guidelines and protocols and different standard orders, so that when a family approaches that decision and that time in their journey, that we can implement those protocols very quickly, and be able to better support our patients and families more nimbly in that process. So I think that stands out amongst other projects. Is something that I think we're all proud of.
Let's hear from Annie a little bit. So I think that I first met you when we were still in the NICU, I think it was, and you would show up on rounds, and I had no idea what MCC was, but you would just hang out afterwards and listen to all of my questions, and that alone meant so much to us and was such a huge help to our family. And I know that other families have shared a similar experience, but so I guess the question is, thinking about all of that and everything you do to support families, can you think of one specific time when you were talking to families or providing care or coordinating some sort of specialty visit where after it was all over, you thought, this is exactly why I'm here. This is what I want to do.
Yeah, definitely. No, thanks so much for saying that, Whitney, because I often think about the fact that I met you all in the NICU as well, and just the amazing journey we've all been on together, and all the incredible choices and thought processes you've had to be the best parent for Malachi. A patient that comes to mind is someone who actually required over 100 different neurosurgeries, similar to the type of neurosurgery that Malachi went through. And I remember recently having to help coordinate with outside hospitals because there was particular procedures that couldn't be done here at Seattle Children's, and she required lots of coordination, both between lots of surgical subspecialties here and specialists at other facilities. And I think being able to help facilitate that communication, both between teams and between hospitals, and to have a really successful outcome for her meant the world to us and our team, just because I think that's something that we work really hard to do, is to make sure that teams are all speaking to one another and that families have a really strong voice in those decisions, and that the patients at the end of the day get the care, the intervention, get what they need to thrive and to live their best life. And so I think for her, just knowing the long and very complicated surgical history she had, being able to do one more, I think intervention like that to support her family felt so meaningful, and she's just been doing great ever since. And so I think that's one that really sits with me.
That's awesome. Let's turn here to the chat section. Can you share more about the history of the MCC program? When did it start and what made it possible? And then if you can talk a little bit about how it logistically happens through insurance coverage and some of the overlap with other services as you do your consultation in the hospital.
Okay. Sure, I'll take that one, Whitney. So the MCC service, I've been here as a provider at Seattle Children's for about 10 years now, and the MCC service predates me by a few years. The service started in 2007, and it was actually initially developed in part to address some of the care gaps we were seeing with children with spina bifida in general, and through a collaboration with our neurodevelopmental team. And since that time has only grown as far as the number of providers involved, our inpatient consultation services, so that, whatever medical or surgical team that our kids land on, we're able to co-follow those patients. you were asking a little bit about logistics. And what we do is, when kids come into the hospital, again, regardless of what team they're on, a lot of times our medical colleagues, other physicians, other medical specialists, will give us a call when they think a patient might qualify for patient identification for our service. And what we do is there's standard criteria that we apply, and they're based on things like medical fragility, frequency of admissions to the hospital, technology dependence, because we're really looking to identify those kids who are most at risk for care gaps, which tend to be some of our most complex kids. And when we identify someone to be followed by our team, actually in our electronic medical record, we'll place a flag. And what that allows us to do is that, when our kids come back into the emergency room or are having some kind of scheduled procedure, we actually know instantly that our kids are in house, so that when they get admitted to another team, we are able to co-follow them and follow along daily to help the primary team with again, continuing that story and providing medical advice and dealing with any care coordination gaps. And like I said earlier, also, just to wrap up, we do have some care coordinators who help us so that when kids go home, they're able to handle some post-discharge needs. Probably the one big gap, which we don't have, is a complex care clinic. And so I think we make do the best that we can. But ironically enough, when kids aren't doing as well and have to come to the hospital more often, that's actually when we get to know them the best, and to continue that story and to be there when things are particularly challenging for our patients and families.
Thank you. That's looking back. Now, looking forward, where do you see opportunities for growth or opportunities to increase the impact of the MCC program in the future?
I can try to take that one. So as I alluded to a little bit earlier, is that, it appears with advances in technology and such, the medically complex child population is only growing. And we continue to identify new patients, every single week when we're here at the hospital that would benefit from our services. I think areas where we could expand or grow in the future, Dr. Leggett alluded to one of those, which would be having a presence for kids when they're not in the hospital. A lot of programs do have complex care clinics where children can come in and see the complex care physician, the care coordinators, maybe some of their therapists or a nutritionist in one setting, and kind of have that overall, shall I say, well-child check with a pediatrician that is well-versed in caring for complex kids. And that is something that right now we haven't had the opportunity to have, and I think in the future could be a great benefit to our patients and our families. And what a joy it would be for us to be able to see our patients when they are feeling their best and out and about in the world, living their daily lives, because we often only get to see them when they're here in the hospital and undergoing a procedure or an illness that was unexpected.
Thanks. That is the talk of the MCC families, is how beneficial that type of service would be for all of our kids. So, and I guess that's a great segue, because expanding programs necessarily requires certain funding streams to be found, and turning to philanthropy and how philanthropy can help support these programs and kind of move the needle forward in that expansion. We did have a question in the chat box specifically about uncompensated care. And let's see, first, could you speak about how uncompensated care comes into play for MCC patients and families, especially with it being just a continuing priority in philanthropic need?
Sure. Thanks, Whitney. I'll say that, where it tends to come into play, I think, for a lot of our kids is, I think you were actually alluding to earlier with some of, Malachi's longer hospitalizations, is that, we encounter a lot of families who, after spending many months in the hospital, you can imagine the resource limitations there, and the financial burden to families over a very long hospitalization. And I think where that often comes into play is that even when a child is medically ready or technically ready to go home, that there may be other resource barriers like lack of community nurses, lack of home health nurses to support the family at home. And so as a result, we oftentimes have patients and families camping out in the hospital for a prolonged period of time. And we have been very blessed over the years, and that Seattle Children's has had the ability to offset that burden and to support families with our uncompensated care fund. But I think with any hospital these days, with COVID, the pandemic, a lot of hospitals are struggling to even those who have historically had robust uncompensated care funds to be able to support our families and not have that burden fall squarely on them and their families. And so I think now is a particularly important time to see how else can we support our families through resources like uncompensated care.
Whoops, we lost you, Whitney. There you are.
Yes, there we go. Okay. Sorry about that. I had just little technical difficulties there at the end. So moving beyond the uncompensated care fund, how else does philanthropy benefit the MCC program? And what opportunities do you see for philanthropy to help expand the program and services available?
So I think a big one, like Dr. Leggett said, is the uncompensated care. There is something wonderful about knowing that as a physician, I can choose what I think is the best care and the best route for my patients, and I'm not worried about insurance not paying for it and families being burdened, because I know that my hospital is behind me and is supporting what needs to be done for the patients in real time. Other things I can think of is that there are many times when we're working to discharge a child where we're trying to really make things work for the family. And maybe this child needs a specific stroller that isn't covered, or their last one hasn't been too long. It hasn't been enough time between when insurance paid for it, but they've grown and it's not working for them anymore. Or maybe it's a family that's struggling to install a wheelchair ramp so that they can bring their child into the home, or get a piece of equipment that's really going to make caring for their child easier. And I know there have been so many occasions where our social workers and our care coordinators have brainstormed and thought, where can I find this piece of equipment at low cost, or how can I help the family get this? And I think that's a place where philanthropy could really help some of our families individually, when we know that there are those things that would make caring for their child at home easier, their child's life better, but maybe the family doesn't have the resources or insurance isn't going to pay for that. For one family, I remember it was something as simple as getting a baby carrier so that the mom was able to carry this baby that really soothed with that personal touch, and allowed mom to have her hands free so that she could care for her other children. That's something that insurance wouldn't pay for and this family couldn't afford, but just having that, small piece of equipment could make this family's life so much better.
So more broadly, is there anything else you think that people should know about the MCC program, or how MCC patients and families can access care at the hospital?
Yeah,
Yeah, I think a couple of services and things that are really unique about our team is that as we have more nurse practitioners and lots of physician support on our team, we've been able to meet families kind of wherever they're at. So if they're in the ED and could really benefit from having one of our providers come down and tell the patient story and support providers in other areas of the hospital, we really are making an effort to try and to show up in those spaces. I think another neat thing I wanted to highlight is that for some of our kids, and I think Malachi included, we create medically complex care plans for our children that live within our electronic medical record. And these are great, succinct summaries of our patients' medical issues and what families' kind of baseline cares are for their child, and then suggestions that we've built up over time and that we know have been successful when that patient shows up and is ill. And I think that's just an example that something that our clinic and emergency room provider colleagues really utilize and appreciate, and especially when a patient with tracheostomy and ventilator dependence and a very long surgical history and long problem list shows up to any clinic or any care facility, it can be intimidating for providers or nurses or any care provider that hasn't met them before. And so I think those are just some of the ways that we try and support our colleagues and help tell our patients' stories over the long term.
Absolutely, that care plan is worth it is worth the visit to the hospital just to walk out of there with. So I have one more question that came in through the chat box, and then if anybody else has questions, please drop them in. Let's see. We are wondering how patients' mental health needs are addressed alongside their other medical needs.
Yeah, sure. This just brings to mind a patient that I had recently who required psychiatry support and really needed to be connected also with our autism center and hadn't done so yet. And I think that from our end, we were able to connect with those other consultants and those outside groups and clinics to really share his story and his trajectory where he had been and the challenges we kind of foresaw in his future. And so I think that psychiatry support especially is very limited and hard to secure for our patients, both inpatient and out. So I can't say it was an easy and quick way that we could support the patient, but thankfully for this young man, we were able to connect him with our autism center and with inpatient psychiatry and to eventually find therapists outpatient for him near where his family lived for them to be supported long term. But I think for a lot of our children that have a lot of medical complexity, that it's sometimes, I would say the mental health piece can sometimes be overlooked by, especially if you're in a very critical medical state. And so I think that it's something that we are always trying to keep in mind, and we're always trying to think of ways to better support children in that way.
That's great. That's great. So I don't see any other questions in the chat box, so I am going to kick it back to Cole. But I just want to thank you all for letting me join you today. It's always good to see you, even if it is virtually. So yeah, back to Cole.
Thanks, Whitney. Thanks to the medically complex care team, and thanks to you, Whitney, for sharing the story. I think you're doing quite great at your most important job, being not a mom. So keep up the great work. He's very lucky to have you. With that, I want all to know we did indeed record this event, and we will be sending out a link via email next week in case you have any friends or family you'd like to share this with. I just want to thank all of you again for joining us, for supporting our work. We hope to see you next month virtually at our annual research fundraising breakfast focused on health equity for all children on June 15th. And save the date for celebration, our fundraiser supporting life-saving advances for kids with cancer on September 10th. With that, I just want to say thank you so much for being here and have a great rest of your day.